about monitoring a patient with acute liver failure. So whenever you have acute liver failure, you have to be very careful with the cardiovascular system. So monitor the cardiovascular system, monitor the brain function, monitor the renal and fluid balance, monitor the blood for basic parameters, and obviously screen for any infection because that will aggravate the encephalopathy. So first starting with the cardiovascular and respiratory monitoring. So monitor the pulse, monitor the blood pressure, and to maintain the fluid balance, check the CVP, central venous pressure, if there is excessive fluid or there is fluid deficiency. For the respiratory function, monitor the respiratory rate and obviously do the pulse oximetry. For monitoring the brain function, look out for GCS. What is the status of the E, M, and V? And if possible, do the invasive monitoring of the intracranial pressure. And oftentimes in patients with hepatic encephalopathy, the patient can develop cerebral edema, and that raises their intracranial pressure. Monitor the intake, how much fluid is getting into the patient through the IV cannula, through their oral intake, and output through their urine, through their vomiting, and if there is any diarrhea, what is the output? Then do the blood tests, which are a pivotal part of the monitoring. Get a CBC, and CBC you will get an idea of any infection, any changes in the platelet count, any changes in the WBC count. Do the prothrombin time, which is like the seminal investigation for monitoring the liver function. So that will be the best test to assess for the liver failure itself. If the PT is rising, means that liver failure is not improving, rather it's deteriorating. But if the PT is falling, probably means that the liver failure is improving. Do the electrolytes, including the sodium, potassium, magnesium, calcium, and also the bicarb. And usually the electrolyte imbalances tend to aggravate hepatic encephalopathy. And hypocalcemia, hypomagnesemia, hyponatremia usually increase the risk of seizure. And hypokalemia and hyperkalemia increase the risk of cardiac arrhythmia. And same for hypocalcemia and hypomagnesemia, they also increase the risk of cardiac arrhythmia. Check the sugar. Hepatic encephalopathy tend to cause hypoglycemia because liver is the source of sugar. Then renal function test, check for urea and creatinine, because oftentimes whenever there is liver failure, it causes a renal disease or renal injury. Arterial blood gas, usually liver failure causes a metabolic acidosis. Infection screen by checking the temperature regularly and taking culture from blood, urine, cannula sites, and throat culture. And we also can do chest x-ray, especially if the patient has cough or the patient has chest pain, then we will do a chest x-ray. So those are the monitoring parameters in patients with acute liver failure. So what sort of complications are we looking for? The complications that can occur in acute liver failure are, first of all, cerebral complication. The patient can develop encephalopathy, and the patient can develop cerebral edema. And obviously, encephalopathy and edema can lead to seizures. Then the sugar, I have already mentioned, the sugar can be very low, so the patient can develop hypoglycemia. ABG, the patient can develop metabolic acidosis, so the pH will go low and the bicarb will go low. There will be a metabolic acidosis. Then I tested for infection because the patient can develop infection, bacterial infection and fungal infection. I've talked about the renal failure. The patient can develop an AKI. So that's why we're checking the renal function. And if the patient has a severe hepatic encephalopathy, this can lead to a multi-organ failure, or MOF. So those are the complications in a patient with hepatic encephalopathy.